Hello and happy Thursday. It is time for our live with Dr. D session. Many apologies for having to kind of push the time back a little bit, but hopefully that means that more people will be able to join this broadcast. It is Thursday, and I don't know how it is where you are, but it is a rainy, gloomy Thursday today. So, what better way to spend it than to spend it live with me today? Um, Please, as you come in, send me a wave, type in the comment box so that I know that you are here. If you're catching this on the replay, also type in a replay just so that I know that you are here. Today's topic is which rehab do I qualify for? And many of you know me. My name is Dr. Dewan Carpenter, also known as Dr. D. And I am a board certified physical medicine and rehabilitation physician, which means that I focus on all things related to helping people improve their function and quality of life in regards to any injuries or conditions related to the brain, spinal cord, muscles, nerves, ligaments, all of that. Today it is which rehab do I qualify for? So the purpose today is to tell you and help you to understand that there are different types of rehabilitation and everybody doesn't qualify for them. So to start off, your insurance benefits may or may not include rehabilitation. So it all depends on your plan. But so there's basically four different types of rehab in the process. The first, we're going to talk about inpatient rehabilitation or acute inpatient rehabilitation, which is when a patient is coming out of the hospital. Let's take stroke for instance. Patient was admitted to the hospital for stroke, and because of the deficits that they have of their stroke, they are not able to go back home. Let's say they live by themselves and they were doing everything on their own at home, but they are not able at this point to do that. So inpatient rehabilitation may be an option for them. Now, there are still a bunch of different things that they need to qualify for and evaluate. But acute inpatient is what we call a short stay, high intensity program, meaning you are transferred from the regular hospital, sometimes regular hospital floor, to the rehab floor, sometimes to the rehab hospital, which may be not within the hospital itself. But that means that you require physical therapy and occupational therapy, and that you can handle doing 3 hours of therapy. And that's not 3 hours all at once, but 3 hours in the course of the day. And it depends on what your needs are. But it's short stay, so a lot of times, patients are these days there for a week, maybe 10 days. So you have a short period of time to kind of get back up and, kind of in your regular routine, so to speak, before you are able to get back home and continue your rehab. Now, for people, and with that being said, also there are certain diagnoses that qualify for that as well. So you got to be able to tolerate that short program. You also have to be able to um, you also have to have a diagnosis that is considered rehabable in that particular setting. Some of those include stroke, like I mentioned, traumatic brain injury, um, sometimes, Parkinson's exacerbations, or multiple sclerosis exacerbations sometimes will qualify. There's a whole list of diagnoses, and honestly, it just depends, on that individual as well. The second type of rehab is called subacute rehab, which is where patients go from the hospital to a rehab setting, but they have a longer duration of rehab time and not as high of an intensity. So in this setting, you can actually have therapy from 1 hour a day, sometimes up to 3 hours a day. It depends on the person and it depends on the setting. But um, essentially, it gives you a longer time. So, slower progress is usually seen in this setting. And for the most part, again, that is patients that, have um, a diagnosis or condition that has occurred where they're just not 100% safe going straight home right now. We see a lot of patients who have had joint replacements now. So if you had a knee replacement or a hip replacement, sometimes um, there's a need to go to a short um, a less intense rehab program for a little bit of time before going home. Sometimes it's just people that have been, had medical illnesses like pneumonia or congestive heart failure, being in the hospital, just, being in the bed, and they have developed some weakness or some difficulties getting up and doing their everyday, feeding themselves or sometimes dressing themselves, and they don't have anybody at home that can help. Um, the third rehab option is home therapy, home rehab. This does not necessarily require a hospital stay, although the people who have gone to the hospital and either had inpatient or subacute rehabilitation typically do still continue their therapies at home, only because obviously, even 2 weeks, it usually takes longer for a person to be up and running from whatever condition kind of set them back from being able to function like they were able to before. And at home, obviously you're in your own home setting, but you'll have a therapist, either physical or occupational therapist, sometimes speech therapist, that comes to the house a few times a week and works with you that way. The other thing is sometimes patients can be seen in the office and may require home therapy. Now, the thing with um, home therapy, if it's not in the setting of following in a hospital stay, is that there are still some requirements. You can't just say, well, I don't want to go out someplace for therapy, so I just want to do it at home. You have to actually have justifiable limitations where you cannot at that point physically make it to a therapy office, or you don't qualify for inpatient or subacute. So that is another option where you continue your rehab. From there, the fourth option would be just outpatient therapy, which probably all of us have driven past, signs that say therapy. So this is where you actually go to the therapy, sometimes 2, 3 times a week, depending on, what is needed. And you um, see the therapist. Usually there's a therapy gym where they may have some equipment, stationary bikes or hand bikes. They may have um, some weights or, stretch bands that they work with you on, mats and things like that, where you go. Now, some of this can be a continuum. So sometimes patients go to acute inpatient rehabilitation, and the amount of time that they are allotted at that particular level, they still are not able to go home safely. And safely, we mean, where they can do what they need to do um, without risk of falling or without risk of, if they had wounds, without risk of infection, that there is anything precluding them from going home, then they may be referred to the subacute rehabilitation level to continue to work on their rehab there. And then from that point, then they may, once they go home, still get home therapy until they have progressed to a certain level where they can go to outpatient therapy. So the big thing is, kind of the big take home is that every situation is different. And so patients are evaluated based on their own specific condition and set of circumstances. Okay. So, if you if you live alone, that may require some additional things to consider as far as if you need rehab and which particular setting that would be required for you. If you don't live alone, but you have someone who works, and you're going to be home during the day, again, we're looking at safety and how well you can function. And usually we evaluate patients based on their ability to ambulate, their ability to feed themselves, their ability to get dressed by themselves, their ability to go to the bathroom on their own, their ability to do their own grooming, and their ability to shower or bathe. And all of those things can give us a lot of information on just their basic level of functioning before their injury and then now after their injury has occurred. So, just to recap, there are 4 different types of rehab settings. And for each of those, there are different qualifications. And all of this may also be based upon your insurance benefit. So, one of the things about outpatient therapy, which didn't quite used to be as prevalent, at least from what I'm seeing, is their outpatient therapy did not used to have a copay. And now most insurance plans include a copay, which some of them I've heard up to $100 a visit. Typically in an outpatient visit for therapy, usually we're sending you to therapy 2 to 3 times a week for at least a month. That can add up quite quickly. So it is important to look at your insurance benefits when, open enrollment starts, because having those benefits can help in the event that you or a family member or friend finds themselves needing some therapy. All right. So the 4 settings are acute inpatient rehabilitation, which is very short stay, high intensity program. The second one is subacute rehabilitation, which is, an inpatient type of stay but it's more longer duration and less intensity. And then home therapy, which is in the home setting and only, 1 to 2 times a week for a short period of time. And then outpatient therapy, okay, which is the progression of that. So, again, really today I just wanted to kind of shed a little bit more light on some of the kind of basic nitty gritty things of rehab that actually come up a lot when we talk to patients. Why am I not going to this place, um, um, or my friend has gone, to this place, but I don't qualify. Why is that? I think it's helpful to be able to understand those kinds of things. So I hope that this kind of short episode was at least packed with some information that you find useful, that you can share and pass along. Hey, Tamika, I'm glad that you could join me today. If you have not already subscribed to my page, please like my page and hit the notification to let you know when I will be going live. I am hoping that next week there will not be any scheduling conflicts and we'll be able to meet at our regular time. So if there are no questions or comments, thank you for joining me. I hope to see you next week when we will talk again at our regular time, Thursday at noon. You have been watching Live with Dr. D. And as always, you have one life to live. I want you to make it count. All right? Live your best life. We'll talk to you next week. Bye-bye.